Researchers believe a drug used for type 2 diabetes and obesity, semaglutide, commonly known as Ozempic, might also help slow the aging process. Semaglutide has benefits beyond what we initially imagined, said Professor Harlan Krumholz from Yale School of Medicine after new studies were published. These studies suggest that semaglutide could potentially treat a range of illnesses related to heart failure, arthritis, Alzheimer's, and even cancer. Improving people's health this way could actually slow down aging, Professor Krumholz told the European Society of Cardiology Conference 2024, where the findings were presented. The data was published in several medical journals, including the Journal of the American College of Cardiology, JACC, edited by Professor Krumholz. These medications could revolutionize cardiovascular care and significantly enhance cardiovascular health, he stated. Part of the SELECT trial, the studies followed over 17,600 individuals aged 45 or older, who were given either 2.4 milligrams of semaglutide or a placebo for more than 3 years. Participants were obese or overweight, with cardiovascular disease, but did not have diabetes. The results showed that those taking semaglutide had a lower death rate from all causes, including cardiovascular issues and COVID-19, compared to the placebo group. While the drug did not reduce the likelihood of contracting COVID-19, it did reduce mortality from it, with 2.6% of semaglutide users dying compared to 3.1% in the placebo group. The drug also consistently reduced the risk of adverse cardiovascular outcomes regardless of sex and improved heart failure symptoms and inflammation levels, even without weight loss. Dr. Benjamin Sirica, a professor at Harvard Medical School and lead author of one of the studies, noted that overweight and obesity increase the risk of death from many causes, but this can be modified with potent incretin-based therapies like semaglutide. Semaglutide, marketed as Wegovy for obesity and Ozempic for diabetes, is available by prescription and suppresses appetite by mimicking the hormone GLP-1, which helps people feel full. Experts caution that the drug is not a quick fix and should be used alongside a healthy diet and exercise under medical supervision. Common side effects include nausea, upset stomach, bloating, and gas.